So treatment of biceps tendonitis, there's not a consensus. There's been a real good case series. So what you all do for lateral epicondylitis is eventually do eccentric training, and that's really probably the thing that I would say is the best thing if you have a true biceps tendonitis. So you have to have them laying down and going into eccentric biceps. So they bring the weight down, and then you can add elbow extension with that as they're doing that. So they're actually laying on their back doing that. There's a study by a lady named Amy McDevitt out of Colorado that actually showed that. That's clinical. The thing that makes you think biceps tendonitis, on top of it hurts in the front of the shoulder, if they've been doing internal and external rotation because they think it's a rotator cuff and that's not getting any better, that's also a telltale sign in my experience that they've been screwed up and they were treating rotator cuff when it was actually a biceps. Because most biceps tendinitises don't like that aggravates their symptoms. And they're like, oh, you're just weak. People are idiots sometimes.
Because it's compressing the bicep?
It's actually,
or?
it's stretching it out over
Okay.
that. There is a mechanism of bicep instability, so it can actually get out of the groove and get out of that. That's way down in the weeds, but there is a component of biceps tendinopathy that there's instability around that ligament that holds it in place.
Okay.
So that can happen,
But weeds.
but that's weeds.
Okay.
Yeah. All right. So the other two tests that are classically done for all rotator cuff tendinopathy are Neer and Hawkins. So Dr. Neer and Dr. Hawkins are two famous shoulder surgeons that have these tests. It's a Hawkins-Kennedy test. So you learned that, I'm sure, in PT school. You all have never heard of that or have?
I've heard of it.
I've heard of it.
Oh, good.
Here. Well, I think we covered it like one day.
Yeah, right.
That was a long
remember
time
that
ago.
day?
That was eons ago. Captain.
Oh, you all were in school
We were in
together?
school.
Yeah.
Okay, so they're pretty easy tests to do. They're stupid because they're passive tests. And you're looking for musculotendinous problems. This is why they're very useless.
Yeah.
They're sensitive, but not specific.
Okay.
So what that means is with a rotator cuff tear, a biceps tendon tear, a bursitis, a labral tear, they all could be positive. They're not specific to a diagnosis. That test I just showed you, those 3 biceps tests, they're at least more specific for bicep tendon tests. And later on, I don't remember what page, but a couple of pages back, yeah. So on page 6 of your all's handout, I have all of the sensitivity and specificity because I hadn't talked to you yet to know if that was going to be part of the quizzes or not. So that was summaries from the literature on which ones are more specific. A sensitive test is good for screening. A specific test is good for identifying the actual pathology. So these tests, the Neer and the Hawkins test, will be a question on your board about if a patient has a positive Neer test, which one of these things is likely to be the problem, or that will be a component of that question. It'll either be Hawkins, it's called Hawkins-Kennedy, so they work together, Dr. Hawkins, Dr. Kennedy, and then Dr. Neer is sort of the father of total shoulders in America. He didn't invent total shoulders, he just brought it from France. So let me show you these 2 tests. So they're passive tests, which makes it not very logical for a musculotendinous. So Neer's test, you basically stabilize the scapula and you passively elevate the arm, and it pinches the supraspinatus between the humerus and the acromion. That's why I have to hold the scapula down. Some people will wind it up and internally rotate and do it, but that's not exactly how Neer described it. But you'll see people, oh, you got to internally rotate. Yeah, you can. It's just adding more capsular tightness and tightening it up. The other one is Hawkins-Kennedy test. So the arm is abducted And for the video, I'm gonna show it a little incorrectly, and then you internally rotate. And again, you're jamming the acromion. So the acromion's on top, here's the humerus, and in between there, in about a centimeter of space, lies your supraspinatus. So that's supraspinatus. So I'm adducted, internally rotated, but the test is really done in flexion.
That
And you
doesn't
can,
feel great.
and you can see her shoulder. I'll switch off.
Yeah.
So if I'm looking right here, now I know I can feel I'm at in range. We talked about a tight in range.
Yeah.
So I can start to see that scapula. And I can force it back, but it'll just cause more and more pain. So y'all do that on each other. It's pretty easy test.